My name is Elizabeth Dreiser, and I'm pleased to welcome you to today's episode of the Roots Learning Series, developed by the Funders Coalition Ending Food-Related Disease, in concert with Samuel Lawrence Foundation and Eat Real. I'd like to thank the leadership of both organizations and our wonderful speakers who you will hear from shortly. And I'd also like to thank the many hands behind the scenes that made today's events possible. Laura, Jamie, Maria, Tony, Augustina, thank you all. Okay, and now we'll turn our attention to today's topic, the surprising reason our health and mental health, particularly for children, are collapsing, and what foundations, governments, attorneys general, and each of us can do about it. Today, we're going to hear from our leading experts in the field, Dr. Christopher Palmer and Dr. Michael Goran, about how ultra-processed foods affect not just our physical health, but surprisingly also our mental health and childhood development. After our panel's presentation and discussion, the impetus for this coalition will become clear. We'll also share plans and participation opportunities for those that are so inspired. It is now my pleasure to introduce the coalition's program officer, Thomas Evans. Thomas, the floor is yours.
Thank you, Elizabeth. My name is Thomas Evans with the Samuel Lawrence Foundation. We connect our community through advocacy, education, and science. We're pleased to be partners in this important coalition and support efforts to improve our nation's health, in particular our physical and mental health. Before we begin, a few digital housekeeping items, if you will. Please know that the Q&A feature is enabled, and we will actively participate and answer as many Q&A questions as possible. But for those that we don't have time to address, we will be answering questions directly via email. Okay, next slide, please. We are here to discuss the rise of chronic disease as a result of ultra-processed food consumption. Ultra-processed foods are industrial formulations created by manipulating sugar, oils, fats, salts, preservatives, stabilizers, emulsifiers, artificial flavors, so on and so forth. They are hyper-palatable, highly addicting, often advertise health claims, and are aggressively promoted. Simply put, if a consumable product has a label, it's a warning label. Next slide. The industry started in the early 1800s with the mass production of candies. And during World War II, preservatives, emulsifiers, and artificial flavorings entered the food supply at a massive scale. Just as the Surgeon General announced that smoking causes lung cancer, in 1964, the R.J. Reynolds Company purchased the Hawaiian Punch Corporation and began marketing sugary drinks to children. In 1985, R.J. Reynolds acquired Nabisco for $4.9 billion, creating the largest multinational processed food conglomerate. Concurrently, there are a handful of major corporations in control of the global food supply, but in reality, it should really look like this. Next slide, please. Now it is my pleasure to introduce Nora LaTorre. She is our moderator for today. Nora is a true maverick in the health landscape. As the CEO of the award-winning organization Eat Real, she is spearheading efforts to heal decades of damage caused by ultra-processed foods in schools. Nora is the chairwoman of the Aspen Institute's Socrates Scholars, part of the X Prize community, and sits on the Tufts Food and Nutrition Innovation Council. She is a preeminent member of the California Government Farm to School Working Group, and recently, Nora shared the message of the Great American Health Collapse on the TED main stage. Under her leadership, Eat Real is on track to optimize $1 billion of school cafeteria budgets by the end of 2025. A really astronomical number. Nora invests in collaboration to nurture innovation and rising stars. And it is now my honor to invite Nora LaTorre to the stage to share her opening remarks and moderate today's event. Thank you, Nora.
Thank you, Thomas. Thank you to the Funders Coalition Ending Food-Related Disease team. It's truly an honor to both moderate this event and be a co-founding member of the coalition. I will say a few words about the global and national health crisis, as well as the organization that I lead, Eat Real. And then I'll turn it over to our wonderful inspiring lineup of distinguished experts to each share their work and their insights. And then we'll moderate a panel discussion, and thereafter our coalition leadership will share closing remarks, next steps, and action steps. So I'm Nora LaTorre, CEO of Eat Real, which is a leading children's health and planet health nonprofit where we believe every child deserves a healthy, delicious future on a livable planet. We believe that ending food-related disease is the cause of our lifetime. We believe that it is the biggest problem facing society, that global sickness and planetary sickness are coming from food, and that this is the biggest opportunity to zoom out at a global level and at a national level. Today, our broken food system is wreaking havoc on our health and our planet's health and our economy. So in economic terms, starting quickly, zoomed out, the world's broken food system costs over $12.7 trillion a year. And that is, we believe, an underestimate. So we're actually calling this phenomenon American health collapse. American health collapse is the idea that for the first time in US history now, life expectancy is peaking and children are on track to have shorter lifespans than their parents. And so what people may not realize is that actually American life expectancy peaked in 2014, 6 years prior to COVID. And the single biggest driver of the decline in life expectancy is preventable ultra-processed food-related diseases. So in terms of American health collapse, over 1,600 Americans die every single day from chronic ultra-processed food-related diseases. In just the US alone, they think that from 2011 to 2020, over $16 trillion was spent on preventable ultra-processed food-related disease. And these diseases are not just taking away lifespan, they're taking away health span and happiness span. And what's most shocking about American health collapse is that it's intensifying for America's youth. Ultra-processed food-related diseases, diseases that used to show up in adulthood, adult onset diseases, are now showing up in our children at alarming rates. So in adolescence, diseases like type 2 diabetes, depression and anxiety, ADHD, pediatric cancer, obesity, fatty liver disease, which was a disease of alcoholism, which is now a disease of sugar, is showing up in our children. Disordered eating and allergies are soaring in America's youth. Not surprisingly, the United States is the top consumer among these nations of ultra-processed food. And we spend the most on the diseases that then those ultra-processed food drive. It's an unequal balance because today our US food system has about $2.36 trillion in revenue, but we spend more than $3.2 trillion in health, economic, and environmental impact from those ultra-processed foods. So this is a quick map of the United States. And so this shows just how intense ultra-processed food-related disease and chronic diseases are becoming across our nation. And you'll see that this disproportionately impacts the South, rural and urban communities, and especially we'll hear especially from Dr. Michael Goran about how this disproportionately impacts BIPOC communities. Those same places that are disproportionately impacted by ultra-processed food diseases, preventable diseases, chronic diseases, are also the places where we're seeing the biggest decline in life expectancy. I want to add, and Dr. Christopher Palmer will be sharing about this, that this is not just about our physical health. This is about our mental health, and there is a direct connection between our physical health and our mental health. And within this crisis of declining lifespan, health span, there's also declining happiness span. And today in America, there is a major mental health crisis happening in our youth. Over 108 million major depressive episodes, 50 million in substance use disorders in adolescents, and over 3.4 million instances of thoughts of suicide. So this is impacting our children's ability to have happy childhoods. Really quickly about our organization, we take a systemic approach to making change upstream to fix these issues and stop disease before it starts. We have an advocacy arm where we really focus on creating systemic change and rolling policies that are better for our children at the national and state level. We passed the first sugar standard ever in America's history. We just passed the first food dye standard, and we're now working on a national food dye standard and much more. We believe that you have to have top-down change. We also believe in creating awareness, which is why we're so thankful that you're all here today, and that you'll help us raise awareness on this critical topic. And most importantly, what we do is we change the food system for kids, and we work on changing core calories so that they're real calories and not ultra-processed calories. So the number one way we do that is we actually work with the largest restaurant chain in America, which is our US public school system. Schools are bigger in unit locations than Subway, Starbucks, and McDonald's combined. So we are launching in 20 states, helping schools overhaul their school food system to make real food in school available to children and change the core calories of kids. And we are so excited and thankful to be doing this grassroots, community-driven work. Finally, I just want to say that we're at a meta level very thankful that there's a massive shift happening in the funding landscape. I think everyone is realizing that we've been really worried as a nation about hunger, and we should be. Fighting hunger is critically important, but we can't just fight hunger. And just fighting hunger has unintended consequences. When we just fight hunger, there's nutritional imbalance, environmental impact, inequitable access, local market disruption, and less culturally relevant items to people. But when we think about actually creating nutrition security, then we aren't fighting hunger, but creating disease. Then we can really fight hunger and create health, expand happiness span, expand health span, expand lifespan. So this is why we think that this is so urgent. It's expensive for the world and our country, and it's especially damaging to the health of and the happiness of our nation. So with that, now I'm very excited to be introducing you to one of my mentors and one of the legends in this work, Dr. Christopher Palmer. Dr. Christopher Palmer is a Harvard psychiatrist, researcher, working at the interface of metabolism and mental health. He is the founder and director of the Metabolic and Mental Health Program and director of the Department of Postgraduate and Continuing Education at McLean Hospital and assistant professor of psychiatry at Harvard Medical School. For almost 30 years, he has held administrative, educational, research, and clinical roles in psychiatry at McLean and Harvard. He has been pioneering the use of the medical ketogenic diet in the treatment of psychiatric disorders, conducting research in this area, treating patients, writing, and speaking around the world on this topic. Most recently, he has proposed that mental disorders can be understood as metabolic disorders affecting the brain, which has received widespread recognition in both national and international media outlets. With that, it's my pleasure and privilege to introduce to you Dr. Christopher Palmer.
Thank you so much, Nora, and it's really an honor to be here with all of you. So I'm going to talk about the mental health crisis that we have. So for those of you who don't know, prior to the pandemic, mental and substance use disorders affected about 1 billion people on the planet. That represents about 13% of the world's population in any given year. Rates of mental illness are higher in Western countries, such as the United States, affecting 1 in 5 people. But the pandemic took a toll, and the rates are even higher now. Mental disorders are one of the leading causes of disease burden and disability worldwide. And there's this curious thing. The rates of mental illness across a wide range of diagnostic categories have been increasing for decades now. The rates of autism spectrum disorder have quadrupled in the last 24 years. The rates of ADHD have tripled just since 2010. The rates of major depression have reached an all-time ever recorded high just last year in 2023, both in terms of current prevalence and lifetime prevalence. There's no doubt that this is impacting our youth. In the United States, this was in the middle of the most recent data we have, and I will just have to point out that it was in 2021 when we were still embedded in the pandemic. At that point in time, 42% of students felt persistently sad or hopeless. Nearly 1/3 experienced poor mental health. 22% of high school students, 1 in 5 high school students, seriously considered attempting suicide in the last year. And 10%, 1 in 10, actually tried to kill themselves. Unless you think this was just a blip during the pandemic, I could show you other charts that actually show this has been steadily rising over decades. And overdose deaths. As you all know, we have a drug abuse epidemic, and overdose deaths are up over 5-fold. And many of you are probably scratching your heads thinking, what does food have to do with any of this? This is about mental health. This is about loneliness. It must be about screens and addiction or families. What does food have to do with any of it? Actually, more than most people recognize, because there are strong connections between what we call mental health conditions and metabolic health conditions. I'm not going to belabor you with lots of statistics, but this slide says it all. People who have mental illnesses are much more likely to have obesity or in the future develop obesity, likewise with diabetes, and it becomes a vicious cycle. That people with these disorders are more likely to have mental illnesses, and people with mental illnesses are more likely to have these disorders. And so it is not surprising that at the exact same time that we see skyrocketing rates of childhood obesity, that we are going to see skyrocketing rates of a wide range of mental disorders. This study looked at over 9 million patients. And what they found was that people who first had obesity were anywhere from 50% to almost 400% more likely to develop a wide range of mental disorders, including nicotine use disorder or cigarette addiction, but schizophrenia, recurrent depression, anxiety disorders, personality disorders, somatization disorders. This represents the entire spectrum of brain conditions that we call mental illness. And in fact, this longitudinal study of over 5,000 children followed children from essentially birth to age 24. And they found that children who had the highest levels of insulin resistance beginning at age 9 were 5 times more likely to have a psychosis at risk mental state by the time they turned 24. And they were 3 times more likely to already be diagnosed with schizophrenia, bipolar disorder. Children who gained the most weight around the time of puberty were 4 times more likely to develop clinical depression by the time they turned 24. This umbrella review looked at the consumption of ultra-processed foods and numerous health outcomes. And probably not unexpectedly, people who consume more ultra-processed foods have higher rates of all-cause mortality, higher rates of cancer, cardiovascular disease, gastrointestinal health disorders, metabolic health disorders, but mental health disorders are right there with it. And in case this is surprising, all of these other things represent numerous organs and tissues throughout the body. It is high time we recognize that the human brain is also an organ and is subject to the same damaging forces of a very bad or toxic diet. This study of over 300,000 people from around the world found that those who consume ultra-processed foods several times a day, 53% of them had poor mental health, compared to only 18% of people who rarely or never consumed them. This is a 3-fold increased risk of poor mental health due to ultra-processed food consumption. And as you see in both of the charts, there is a pretty clear linear relationship. The more ultra-processed foods you consume, the worse your mental health. So what can we do about it? This is where I am completely aligned with the messaging of Eat Real, and I am just so much in admiration of all the work you're doing. First and foremost, I just want to say there is not a one-size-fits-all diet for all humans. Some humans are overweight, some humans can be underweight, people can starve themselves to death. And that can also be a problem because that is malnutrition. And malnutrition is also a metabolic problem. So metabolic problem does not always equal obesity. Malnutrition and a lack of calories can also be a metabolic problem. But what are the universal principles that I absolutely endorse? Eat real whole foods, avoid ultra-processed foods with additives and chemicals, avoid added sugars and artificial sweeteners. The World Health Organization is now recommending we should not be eating and drinking sweet things. We should be eating and drinking things that are naturally sweet, like fruit. Those should be our desserts, and we can get toward that. And we should try to optimize metabolic health markers, such as those listed, because this will help optimize brain function, which may also help optimize mental health markers. And with that, I thank you. You can learn more about it at Brain Energy, but I am happy to turn it back over to Nora, I think.
Thank you, Dr. Christopher Palmer. Your work is so critical, and I'm so thankful for your leadership. As a mom of 2 young children, what you shared is particularly crushing, and I'm thankful to be able to do work alongside of you to make change. So thank you so much for your presentation and for all of your work. And now it is my distinct honor to introduce our next speaker, Dr. Michael Goran. Dr. Goran is professor and vice chair for research in the Department of Pediatrics at Children's Hospital Los Angeles and program director for nutrition and obesity at the Saban Research Institute. He is a native of Glasgow, Scotland, and received his PhD from the University of Manchester in the UK. His research on infant and childhood nutrition has been continuously funded by the NIH for the past 35 years, raising $80 million in funding and publishing, as a result, over 400 peer-reviewed articles. In 2021, he founded the Southern California Center for Latino Health, a regional initiative focused on developing academic community solutions to chronic disease disparities in Latino families, and funded by a $25 million grant from the National Institute for Minority Health Disparities. He has received numerous awards, including the Nutrition Society Medal for Research in 1996, the Lilly Award for Scientific Achievement from the Obesity Society in 2006, the TOPS Award for contributions to obesity research from the Obesity Society in 2014, and the Rank Prize Lecture in Nutrition in 2018. Dr. Goran lives in Silver Lake, Los Angeles, and likes to play tennis, cook, eat, hike, and walk his dog, as well as travel. He is the author of Sugarproof: Protect Your Family from the Hidden Dangers of Excess Sugar with Simple Everyday Fixes. Dr. Goran, the floor is now yours.
Thank you, Nora, for that kind introduction and for putting this together. And very happy to be a part of this. And thank you, Dr. Palmer. That was a tough act to follow, but I'll try to lead you through my perspective on this. And here we go. So we've talked about processed foods, ultra-processed foods, and the fact of the matter is 70 to 80% of those processed foods contain added sugar. So that's not the only problem in processed foods, but that's the one I'm going to talk about today since it's the most predominant one. The food industry now has 200 different names for added sugar, making it very confusing. And also, it's not just processed foods, but also beverages and liquid sugars, such as sodas and juices, which have replaced our typical sources of hydration that we were evolved to thrive on, which is water and milk. So there's a life course perspective to this that I'll mention. This process begins early in utero, maybe even before pregnancy. what moms eat during pregnancy has long-lasting effects on that child's nutrition and development, including their brain. Children are more susceptible to ultra-processed foods and to the effects of added sugars for different reasons. There's an intragenerational transmission that's fueling the fire that women who gain weight during pregnancy will have a heavier child, and that child will grow into a heavier woman and then have heavier children themselves. So there's an accumulation of these effects over time, and that's probably why we're seeing the rapid increases that Nora mentioned early on. But I also want to point out there are social determinants to a lot of this. There's an economic disparity, there are social drivers and access to healthy foods, as well as environmental factors we call obesogens, chemical factors in the environment that promote the development of obesity, that lead to these conditions that we've already talked about. And this is happening on a global scale. Next slide. Yes, it's just quickly 200 names for sugar. This is not all 200. But also, Chris mentioned artificial sweeteners. I think this is something to keep an eye on, that because food industry is responding to the need to cut sugar. The food industry is responding to the demand to reduce sugar by replacing sugar with artificial sweeteners, and over 20 different, not just artificial sweeteners, but even naturally occurring sweeteners like stevia and monk fruit that are just as problematic, sometimes even more problematic. Added sugars affect all parts of the body, literally from head to toe. Chris nicely talked about the effects of processed foods and sugars on the brain. I'll talk about chronic diseases, and this slide here just summarizes what we know about added sugars and type 2 diabetes, which is rapidly increasing nationally and globally. There's a meta-analysis that shows this, but it's, as Nora mentioned, this is a disease that used to be called adult onset diabetes to differentiate it from type 1 diabetes. Type 2 diabetes is a lifestyle diet-related disease that didn't used to even affect children until the turn of the millennium. And now almost 30% of children in the US have prediabetes, which is the precursor of type 2 diabetes, and levels are higher among children with obesity and among Black and Latino children. Next slide. This was a recent publication just a few weeks ago, or just last week actually, showing the global prevalence, the global reach of this problem, reaching 800 million people globally. The largest increases in low and middle income countries, and the biggest burden of this disease in terms of numbers are in those 4 countries, India, China, US, and Pakistan. But also there are some smaller countries with very high prevalence, like the Pacific Islands and some Middle Eastern countries, where more than 25% of all adults have type 2 diabetes. And among high-income Western countries, the highest prevalence was in the US and the UK. There's plenty of examples of healthy countries with prevalence levels less than 5%, such as France, Denmark, Sweden, and some African countries. So there's a lot of global variance. Next slide. But also, even though we talk about different variations across the states, even within regions, there's tremendous variation. The map here is a map of the 10 counties of Southern California, Los Angeles County here, San Diego County here. And notice there's some parts of this region with very low levels of type 2 diabetes, and some, such as Imperial County over here, with more than 30% of adults. So we get a lot of regional variation. And over here on this graph here, we're showing the average prevalence of adults with diabetes by 10 counties. These are the 10 counties of Southern California. And you can see, for example, in Los Angeles County, you can have some, this is done by census tracts, some areas with very low levels. So we do have Sweden's and France's and Denmark level prevalences in probably these areas, which are probably more affluent areas. But you have some areas here where over 30% of adults have type 2 diabetes. So I think this points to the need to kind of identify communities that require interventions. And the same kind of variation we see, this is just the same data, but for adults with obesity by county. And you see a lot of regional variation. Next slide. We often think of saturated fats driving heart disease, but actually added sugars and sugar-sweetened beverages is a major significant risk factor for cardiovascular disease. And that is simply because of the metabolism of sugars. Excess fructose is metabolized in the liver, not just causing fatty liver disease like Nora mentioned, which is the buildup of fat in the liver, which is the main cause of liver disease now, replacing alcohol-induced liver disease. But that conversion of sugar to fat in the liver also contributes to dyslipidemia, the production of lipids which build up in the blood and in the arteries and contribute to heart disease. This is a large population-based study that was done looking at adults over 10 years, separated by quintiles of added sugar intake. So adults here with the lowest level. And what this graph shows is the risk of dying from heart disease relative to quintile of added sugar intake, using the lowest quintile as the reference population. And what you can see is across these quintiles with increasing amounts of added sugar intakes, especially at the extreme level, you have a twofold higher risk of dying from heart disease in the upper quintile of added sugar intake. So we have to think of sugars, not just fats, as a contributor to heart disease. Next slide. Chris talked also about sugars in the brain, and studies have actually shown this shocking revelation that regular consumption of sugary beverages is associated with a reduction in brain volume. And this was done in a study from the Framingham study that looked at brain MRIs over 10 years in adults and looking at the effects on sugary beverage consumption, controlling for other aspects of the diet, showing that it was associated with smaller brain volume. Next slide. But you don't have to wait to be an adult to see these impacts, because this was a study done among children looking at the effect of performance on academic test scores, separating these children into 4 groups based on the consumption of sugary beverages. In green, less than 1 glass per day, 2 to 3, and in the red, 4 to 6. And what you can see is that across the range of academic tests, grammar, reading, writing, and numeracy, children in red who were consuming the highest amount of sugary beverages per day performed worse on these academic tests. Next slide. And this slide just kind of points to the impact of intragenerationally. So this shows the effects of maternal soda or diet soda consumption during pregnancy on child learning. So the bars here show the reduction in learning ability at age 3 years of age in mothers, in this case, who are drinking diet soda during pregnancy. Or if you look here, for example, at nonverbal learning ability at 8 years of age, a score of 2 lower performance in those children when mothers consumed soda or diet soda during pregnancy. So this points to the intragenerational transmission of effects through to the next generation. Next slide. And so what we're feeding kids starting early in life, so we're not so before kids even get to school, early feeding can have an impact. And we have, families face a choice of breastfeeding. That would be the preferred source. That's not always possible. We have formula feeding, which is a good replacement for breast milk. But there's also problems with formula, because it's now clear that over 50% of all infant formula is made with corn syrup and not with lactose. Lactose is the sugar that's naturally found in breast milk, which most formula used to be made with. But now companies are making infant formula not with lactose, but with corn syrup, which our studies have shown has a negative impact on infant development starting very early in life. Next slide. So we did a study with WIC. So WIC is a federal program that provides infant formula to families in need. And we did a study in over 15,000 children tracking them through WIC. WIC keeps very close records of these children. And what we found was that those children who were given the corn syrup formula in red, even by 2 years of age, those children were more obese than those receiving regular formula. And keep in mind that these children in WIC, 14% of these children are already obese by 2 years of age. So this is a very high-risk population. They're predominantly Latino. They're all low-income families by definition, where we see the highest prevalence of obesity. So they're already at very high risk. And what we're doing by replacing corn syrup formula is increasing the risk even more, from 14% to 16%, which is sustained through 4 years of age. So we should be doing things to try and reduce this, but instead we're increasing it. Next slide. I want to come back to social determinants of obesity again, coming back to children. So if you look across the US, we see this regional variation. If you look at this map, you'll conclude, oh, California and the Western states are doing quite well. They have lower prevalence of childhood obesity. But if you zoom in and look in Southern California by county and census tracts, again, you can identify census tracts within Southern California where you have problems. We published a study over 10 years ago that showed an economic disparity of childhood obesity prevalence. This is the prevalence of obesity in children in 127 separate cities within LA County. Across the bottom here, the cities are ranked by economic disparity. So you have very affluent populations down here like Beverly Hills and Malibu and so on that have very low levels of childhood obesity, but then you have economically deprived neighborhoods up here where 35% of children have obesity. And then you can also look not just at economic disparity, but here we're ranking the cities by environmental health, access to healthy foods, employment, green space, and you can see again, the unhealthier the city, the higher the prevalence of childhood obesity. Next slide. Hot off the press, we're looking, so we know that social determinants drive obesity, economic disparity drives obesity, but what we're trying to do in this study, which is not yet published, is kind of drill in a bit further because the measures of social determinants and economic disparity have numerous different factors. And so we're trying to identify which of the social determinants has the most significant impact on childhood obesity. So these here are some of the top driving factors. So we're looking at school poverty, minority population, asthma room visits, hazardous waste dumping sites, lead in the environment, and so on, access to green space. And what we found was kind of surprising, not yet published again, so but the paper is under review. The highest single factor driving childhood obesity in Southern California was school poverty, measured by the percentage of children qualifying for free meals. And you can see that educational factors rank pretty highly, economic factors, and so on. Next slide. And then this is also hot off the press stuff we're working on. We're looking even further. And Nora mentioned nutrition insecurity versus food insecurity. And this is kind of interesting. So nutrition, a lot of focus has been on food insecurity, which is the ability just to not be hungry and to have enough food. Nutrition insecurity is very similar, but it's defined by the ability of families' perceived ability to obtain healthy foods. What this slide shows is that household nutrition insecurity was significantly related to the percentage of children meeting educational standards. This is using data from LA County schools, and we're able to get this data because the LA County has this survey that gathers this data. But we found that nutrition insecurity in the household was significantly related to adult health, like adult obesity, adult hypertension, and adult depression, echoing what the previous speaker talked about. But we also see this link to children and their relationship with with school performance. So more nutrition insecurity was associated with poor performance. And importantly, what we found was that this was significantly mediated by this one factor: children's daily consumption of sugary beverages mediated the relationship. And if you click to the next slide, you can see this very clearly on this graph. So this is a graph. The dots in this graph are not individuals. The dots in this graph are cities within Los Angeles County. So it's aggregated data. And you can see a very clear relationship. On here, we have percent of adults in households with nutrition insecurity. And those with most insecurity, you can see have lower levels of children meeting standards. So we need to target these populations where we have a lot of nutrition insecurity and poor performance in schools. These are the areas that need the most help. Next slide. Yes, I'm just going to wrap up there, just to emphasize this intergenerational cycle, because a lot of things that I mentioned are kind of driven by this vicious cycle. So here, if you just kind of follow with me for a second, we have pre-pregnancy BMI. When that increases because of all these factors, we'll get more gestational weight gain, more postpartum weight retention, and then the mom becomes more overweight for the next pregnancy. So we have this maternal cycle going on. And then we have the neonatal cycle going on. Women who gain more weight during pregnancy will have children who are gaining more weight, who are having suboptimal feeding, gaining more weight during infancy and in childhood, and then growing up to become mothers who are more overweight. So we're fueling this with these cycles, and what we need to do is disrupt this intragenerational transmission to get ahead of this problem. And I think that was my last slide. Yeah, I'll just throw those up there and you can take a look at them whilst we transition, because my goal was to end at 10:45, which Nora, I made it 10:45. Back to you. Thank you so much.
Thank you. Well, thank you, Dr. Goran, so much. And thank you, Dr. Palmer, very much. So given the immensity of the situation and considering those who are in our audience today and who will be listening to the recording, what thoughts and/or recommendations might you both suggest as actions, philanthropy, and funders, as well as some of the representatives from Congress, governors, attorney generals in the community would take to support real dynamic change, systemic change that's truly needed? So in other words, if you had a magical wand and you could urge funders to take one action, what would it be? Dr. Goran, how about we start with you, since you just presented?
Yeah, I mean, I think I kind of alluded to that. I think the key is to identify communities in most need, and we shouldn't think of this as a statewide problem or even a county-wide problem or a city-wide problem. I think there are social determinants, environmental determinants. We have to identify what those communities in most need might be and find out from those communities what type of inventions. I think we've done historically too much top-down type of intervention. I think we need more grassroots efforts. Identify those communities, talk to those communities, and find out, get their help to develop interventions to see what might be most effective and have them be involved with that development. I think that's the future that's how we're going to hopefully try and make advances on this problem.
Absolutely. At Eat Real, we wholeheartedly agree, as you know, and are really excited to partner with you and with UCLA so that we can prioritize historically underserved, low nutritional security communities and really do community-driven change so that kids have access to real food to improve all of the outcomes and the correlation between diet and ultra-processed food and poor test outcomes was particularly and thank you for sharing the cutting edge research that you're doing as well.
Yeah, I mean, I think trying to get food corporations to change, I mean, that's just, a huge problem. So that's why also I think we need to kind of take this at a more grassroots level.
Yes, Absolutely. Thank you very much. And Dr. Palmer, welcome back. I'd love to hear from you. With your magical wand, what would you urge funders to do to make systemic, dynamic, and significant change?
I think my recommendation would align with Dr. Goran's, and I would kind of specify it as funding research trials on actual interventions in real communities and measuring outcomes. And because the reality is, a lot of people will say, generic health and wellness recommendations, and those don't translate into actual improvement in clinical outcomes. And so I think that the devil is in the details when it comes to nutrition interventions, and it may be more than just nutrition interventions. We may need to simultaneously do sleep interventions or screen interventions or other things. But we need to look at what actually works in the real world. And ultimately, that needs to be grounded in clinical outcomes. And that kind of research is challenging to do. It's not impossible, but it is very difficult to get funding for that type of research. And so I think if funders can step up, if government can step up, whoever wants to help, but ultimately that is the only way forward. It's the only way forward.
Completely agree with you on the research gap and getting measured interventions. And also, I think it is important, and I appreciate that you always mention this, to really take the holistic approach. Like, yes, food is a major and underreported and key top driver of these issues, but we do need to look at holistic health. And as a mom, I personally see it all the time. It's about the real kids having the real food, the sleep, the social connection, the stress management and emotional regulation, time outdoors, and time away from screens and whatnot. So really thinking about what is a roadmap and having research-backed recommendations on a roadmap for our nation. I think I fully agree is absolutely.
Yeah, and we also have new technologies that can be deployed in these situations, like for example, glucose monitors, which can be used, which is a great tool. We're using those in communities to train people to get biofeedback so that they can learn about how food is really affecting their body with real data and real numbers, and how changes can improve that. So I think we also got to take advantage of the technologies that we have available. And like Dr. Palmer said, we can't just take standard lifestyle approaches and expect communities to suddenly eat healthier and be more active. We got to think outside the box.
Absolutely. Building on this question, we talked about research and grassroots interventions and funders really looking for scalable solutions, and researchers like yourselves that they can back, and coalitions like this that will take a multi-pronged approach. If you could just take a second to underscore if there's anything for children specifically that you would urge them to think about. I think personally, my urge is that they funders prioritize earliest interventions so that we can do this systemic change upstream. But I'm curious from both of you if there's anything that you want to kind of hit home about for funders to focus on children's health, other than really grassroots and research. If there's anything else you'd like to underscore.
I would just support what you're saying, that prevention is actually so much easier and less costly than treating multiple organ failure. So once an adult has obesity and fatty liver and mental health conditions and kidney conditions, it's quite expensive to look for interventions that will treat all of those simultaneously. And it's also an uphill battle, because that person is now very ill after years or decades of something harming their health. And I think with children, the interventions are much simpler. They probably don't need to be nearly as robust as for an adult who is already ill. And they're easier to scale because we can use schools like Eat Real does. We can use places where they're all captive, for better or worse. They're all there, and so we can get them. When you think about interventions with adults, now they're all scattered around the community, and it can be difficult to corral them. One of the funding challenges that I just want to highlight, I've been to Washington, D.C. many times over the last couple of months, advocating for changes in our food system and improved nutrition. And one of the counter arguments to share with people about why they don't want to fund nutrition studies for children is because children's health isn't all that expensive right now. That they're focused on the adults that are costing the system a lot of money and are already on a lot of prescription pills. And so some people have this very narrow-minded, budget-centric focus of, well, it's the adults that are costing money, and treating, the amount that Medicare or Medicaid or commercial insurance has to spend on childhood obesity isn't all that much, because obese children aren't all that sick yet. And so some of the funders are actually reluctant to fund this research that will save billions, if not trillions, in the future, and actually really is the future of our country. I mean, if we do not have healthy adults, we are not going to have a thriving country. Like, we need healthy adults for everything, to be workers, to be entrepreneurs, to defend our country, everything that we need. So I think it's really limited to think of it that way. But I talked with a pediatrician on the Hill who is just sighing, kind of in desperation. Nobody seems to care because children don't cost that much money yet.
I hope that through this conversation, people are realizing that we need to make strategic upstream investments, the tunes of tens of millions and billions of dollars, to prevent the trillions of dollars of spend. And we spend, over 3 trillion, or 12.9% of our GDP every year on sick care, treating these adult diseases. And if we spent billions a year, we could prevent them. So we're hoping that through this conversation and all of your leadership, that we can start to raise awareness. So thank you for underscoring that critical point and talking about the critical importance of both funders and the national government making strategic investments as well. So thank you, Dr. Palmer. I think that's a really powerful place to start to close. So now I'd love to turn the floor back to Thomas and Elizabeth to wrap up today's presentation.
Thank you, Nora. I really appreciate it. And what an insightful conversation we've had. And so through this series, we're learning that ultra-processed foods are a significant mental and physical health threat, targeting our vulnerable populations and imposing a multi-trillion-dollar tax on society. This learning series is designed to share insights from the top researchers and physicians around the world, and the results that we're learning serve as an urgent call to action. Researchers can make the case abundantly clear, and we need to make a serious course correction to improve health for future generations. Next slide. By educating, collecting, and convening stakeholders, the Funders Coalition Ending Food-Related Disease is mobilizing to drive impact. Big food needs to be dealt with like big tobacco. We absolutely need to get schools and the meals served in schools to be a source of nutrition rather than a source of disease. Next slide. There are numerous actionable strategies that will evolve with time, input, and collaboration, as both Dr. Goran and Dr. Palmer mentioned. The Funders Coalition aims to coordinate funders and bridge with stakeholders across the nation to effectively and efficiently move resources to accelerate all of our strategic plans and actions. To learn more about supporting and or advancing this coalition, please complete the survey that will auto-populate in your browser at the conclusion of this webinar. You can also connect to the team that you see here via LinkedIn. And Jamie, our host today, will so kindly post our LinkedIn profiles to the chat for your easy reference. And now with that, I'd like to turn the floor back to Elizabeth to share her closing remarks.
Well, first, I just want to say thank you so much to our guest speakers, to Nora for moderating, for Thomas as well. This concludes our Roots Learning series. This is the second of what will be a series. This has been developed by the Funder Coalition Ending Food-Related Disease, which is a collaboration, and it's in concert with the Samuel Lawrence Foundation and Eat Real, the other co-founders here. I'd like to thank the leadership of both organizations and the speakers and all the others that are participating here, and the hands behind the scenes that made today's event possible. People like Nora, Jamie, Maria, Tony, Augustina. Thank you all. And Jamie will leave the room open, the Zoom open for a few minutes to allow those that wish to copy the links and connect to us to do so. Thanks, everyone. Look forward to next time.